This is Heart Rhythm TV, and I am Julie Shea, here with another episode of Advancing Allieds. We have another segment of AP Spotlight with us today. I have Brittney Murray, Crystal Tichnell, and Cindy James, who are genetic counselors from Johns Hopkins in Baltimore, Maryland. So welcome, ladies.
Thank you.
Thank you.
Yeah, thanks for joining me today. So I just want to throw out a kind of an obvious question. Can you tell me what is a genetic counselor?
Sure. So a genetic counselor, we're master's level trained health professionals who work with a team to take care of patients with inherited heart conditions. And so we really specialize in patients who have a genetic basis of their heart condition and take care of the whole family.
Nice. So conditions like long QT, ARVC, those kinds of things
Exactly.
that oftentimes will manifest as a sudden cardiac death event, right? So
Right, yeah, that's most classic. And then we're moving into, even now, we know that actually AFib can be familial. You know, everyone thinks AFib is bread and butter, but now we see AFib running in families. So we see a lot of early onset atrial fibrillation families now too.
Yeah, and so how do you differentiate that? Like if with the AFib patients, like if it's like several family members have it?
Yep, definitely if it's familial, but actually the new European guidelines suggest that anyone who has presentation of atrial fibrillation under the age of 60 should actually consider seeing a genetic counselor and consider genetic testing.
Oh, that's great information. Okay. So how does your role fit within the kind of multidisciplinary team that you work with? Cindy, why don't we start with you?
Sure. So I've been with the Johns Hopkins Center for Inherited Heart Diseases and specifically the ARVC program for more than 20 years. I am a genetic counselor, but for about the last 10 years, my role has largely been to work with the patients and families and the multidisciplinary team to organize our research. So I direct our ARVC research registry, I direct our Center for Inherited Heart Diseases registry, and that's a really nice role. It involves working with our families to collect their records, get them into the system, supervise students, and really make a difference in seeing the field advance.
Nice. And Crystal, do you want to talk a little bit about what you do?
So I'm kind of the middleman. We sometimes call me the desmosome. I sort of bring everybody together. So patients that we see in clinic, I'll see them in follow-up. I'll discuss various research opportunities with them, get their data into the database, and then Cindy kind of does the magic with putting all that data together. So it's just nice to be that support person, educating families, getting them involved in research to make a difference.
Yeah, nice. Nice. And Brittney, what is your role?
Yeah, so my role is really the clinical care and follow-up of our patients. So I'm working really closely with the whole multidisciplinary team. So with our physicians to get the patients diagnosed, managed, the genetic testing ordered, and then interpreted. And then I'm working with the families to do that cascade screening throughout their family and identify who else may be at risk.
Nice. Nice. Yeah, such an important, piece of this whole care of patients with genetic conditions is kind of identifying at-risk patients and family members. And, it's hard. I mean, have someone like the proband who has an, initial event and then, having to screen the entire family and get them involved. And so that kind of brings me to my next question. What do you find most challenging about your roles?
Right. A lot of that can be talking with families. Sometimes there's a lot of fear and a lot of coping with scary things in the family with denial of, if I just don't think about it, maybe nothing's going to happen.
Right.
And so it can be really challenging, one of the things working with the families to help them understand how this information can really empower them in taking the best care of their health.
Yeah. I mean, in terms of, being told you need an ICD implanted for sudden cardiac death prevention, or in terms of like family planning, young couples that want to get married and then you have to make decisions about, having children. So I imagine that must be a challenging,
it's a hard
piece
conversation. And I've had actually a lot of really long conversations with families that, it's kind of up to them. They factor this into their decision making, and they wish that I would tell them, what the answer is. Of yes, you should definitely have IVF and PGT, or no, everything's going to be fine. They wish I would tell them, but it's kind of in the middle. It's up to them, so that's hard.
Yeah, I imagine that's very a challenging conversation to have with people. So, what do you love about your roles? Can you talk a little bit about what excites you? What gets you to work every day?
I think the most exciting thing for me is seeing the patients in clinic, getting them involved in research, taking that information, putting it into data analysis, and then bringing back recommendations and you know, what can they do with that information? It's like real time. So that's exciting, being able to take that right back to the patient in the clinic.
Yeah. And Cindy, what about your
and
role?
I will say one of the most gratifying aspects for me is to see how far we've come. Crystal and I have been doing this for more than 20 years, Brittney for nearly as long. And when we started, we had such little specific guidance to give our patients, and we're really moving forward towards genome-guided medical care. And I find that really gratifying and really exciting. I also love working with genetic counseling students, young physicians, young researchers. And I get a lot of joy from training up the next generation who's going to continue to work answering these hard questions and ultimately to benefit the patients and families we serve.
Absolutely. I mean, it's just become much more mainstream than it was, 10 years ago or so, which is phenomenal. And I'm really excited about the AFib piece of this, and I think that's a whole untapped area.
Absolutely.
So very interesting. Brittney, what about you? What excites you in your job?
Yeah, I think that my favorite thing is that I get to take care of families. So a lot of, physicians tell me, I just look at the patient in front of me and they have to cycle through, so many in a day, and it can get really busy. But we get really embedded into these family structures because we see so many of them, and sometimes we become part of the family. So I love the relationship building that I get to have as part of my my clinical role with them.
That's great. That's great. Well, thank you, ladies, for talking a little bit about your role as genetic counselors. I appreciate your joining me today on AP Spotlight. And this is Julie Shea here with Advancing Allies for Heart Rhythm TV. Check us out on our YouTube channel.